Hello, I'm David Rubenstein, and I'm the president of the Economic Club of Washington. And I want to welcome you to our sixth virtual event since the corona crisis has begun. We've been trying to give you information about the local community as well as things going on around the country, and we hope you've enjoyed these. Today, we have our membership watching. We also have a number of members of the diplomatic corps who are tuning in as well, and a number of invited guests that who are not members of the club are also involved in listening and watching as well. We have three special guests today. The first is Ted Leonsis, who's the founder, chairman, principal partner, and CEO of Monumental Sports and Entertainment. The second is the governor of Maryland, Honorable Lawrence Hogan, who's also the chair of the National Governors Association. And then we have Kim Ford, who's the president and CEO of Martha's Table. And we'll do them in the order that I just mentioned. I would just like to let people know that probably next week, maybe on Friday, we'll have another program. We're working on the details of that now. And secondly, on April the 28th, next Tuesday, a week from next Tuesday, we have Dr. Tony Fauci, who is reasonably well known these days as the director of the National Institute of Allergy and Infectious Diseases. And we have look forward to a good conversation with him. So what I'd like to do is remind everybody that after this interview is completed, it'll be about 1 hour total, we will put this up on our website, www.economicclub.org, and you'll be able to watch it on video later on if you'd like to do so. So if I could, I'd like to start with Ted Leonsis. Ted, welcome. Thank you for doing this.
Thank you, David. You're doing a fantastic service to the business community, and it was very innovative, and everyone appreciates your work.
Thank you very much, Ted. And as I said, you are the person who has bought many years ago, I think it was 1999, you bought the Caps and subsequently bought the Wizards and the Capital One Center. And you also have Mystics, the Women's National Basketball Association team. So you have three sports teams plus the building. So tell us, how has your business been affected by the shutdown of essentially society?
Well, you can see over my shoulder, I have a replica Stanley Cup and autographed guitar. I just want to remind everybody that we are the District of Champions, not the District of Coronavirus, and that now our champions are our first responders. And while it's affected our business, we are simply in a state of pausing, and we hope to be able to finish in some manner our regular season and then the playoffs. And we want to use this time to really show our appreciation to everyone in the community. We want to put our employees and people first and our players first. And we know our place. I think it's most important, even though it's the District of Champions, that we are very, very focused on that what's happening to society is way bigger than what's happening to us in the industry of sports.
So, Ted, do you think it's realistic that the regular season for the basketball and hockey teams you own can be resumed and that there can be playoffs? Or do you think it's more realistic that we'll just not see any more hockey and basketball this year?
Well, Commissioner Fauci yesterday gave us all a tip on how we should be preparing, which was play the end of the regular season and the playoffs if we can in a way where there's no fans. And that makes a lot of sense. We need to take our cue, and I need to remind everyone on how leagues and teams are organized. Right after we finish our meeting, I go and attend a board of governors. We're called governors with the NBA. And the NBA is like our federal government, if you will, and it will take its lead from governors and the federal government and all of the public health associations, and we listen to them. We can't play games on our own. We have to play within a league format. The players belong to a union. The union deals collectively bargained agreements with the leagues, and so that's That's the focus right now. How can we end our season? The Washington Capitals and the Wizards, we missed 8 home games so far for the Caps, and I think 11 for the Wizards in total. And so we have to figure out how we end the season and then go into the playoffs, and we'll get our direction from the leagues. But also we hear now the governors, in our case DC, it's our mayor, and so we'll figure out where we can play, how we can play, but we are operating in a suspended mode, and all of our focus is on what to do about the remainder of this season.
So Ted, how many total employees does Monumental have?
We have more than 600 full-time employees. We pay about 100 players through all of the teams, and then we have about 1,500 part-time. I felt that it was the right thing to do to pay our part-time employees who had signed up to work for March and April, and it's about $1,200,000. It's not an advance to them. When we come back, they'll sign up to staff the new games and we'll pay them there. I have not had any furloughs or cuts or layoffs for full-time employees. I think that right now we're waiting to get our cue from the city and from health organizations and the leagues on how we move forward. And I, again, also think that I want to use this time productively with our workforce. And I challenge, and I want everyone who's listening, this notion of let's get back to normal is wrong. We have a mantra of let's build to better. Let's take this time, self-reflect, look internally, and what can we be doing better when we come back, organizationally, for our customers, for our fans. How can we innovate? We're a content company. That's a big part of our revenue stream. And because we haven't been able to play, we were the first organization to build these simulated games. And because our partnership with NBC and Comcast is so important to us, we played a regular season on television. And we were able to bring in our announcers and players to comment and be interviewed. We announced today that Wayne Gretzky has challenged Alex Ovechkin to a game online. And we as an organization believe in innovation, and we've been leaders in esports. David, you're a co-investor with us in Axiomatic and Team Liquid. I've been talking a lot about esports. Esports is having its moment right now. It was built digitally first. They're accustomed to working at home and practicing at home. And now we're having our basketball team and hockey team and our whole workforce look like we're an esports company, right? We're doing interactive yoga classes on Zoom to keep the players in shape. And so I think this should be a time of innovation while we've paused. What can we do better? For us in DC, I want us to be additive. I want to leave more than we take. We've paid our taxes up front. We don't have anyone yet seeking unemployment. We are very active in our philanthropy. We'll have Martha's Table on. MedStar is a partner of ours that needs to be celebrated for the work that they've been doing for the first responders. Our players, our employees are being activated. We understand the power of community. And this is just a moment in time. We really all need to get out of the woe is me. This is the worst thing that could have happened. I view this as a pause in what we've been doing, and it should be an opportunity to springboard to a better future.
Are all the other hockey teams and basketball teams around the country also having a no furlough policy? Because I would have assumed that many of them would have furloughed at least their part-time people.
Well, every market, every ownership group is in a, their own unique set of circumstances. We've probably been hurt the most, if you will, because we own many teams and we own the building. Remember, there's many teams that play in a building that's owned by the state. When you interview Governor Hogan, you should ask him, how's he doing right now? The state owns Orioles Park and Ravens Stadium. University of Maryland owns Comcast Arena on the campus. He's the biggest landlord in sports locally. Our mayor and the city owns the Nats Stadium. And, we have DC United, we have Capital One Arena privately owned. So this is we're all in this together. We've all been hit hard. We've been focused on always being fortified to run a good, lean organization. We're fortunate we aren't burdened with too much debt. And I published a paper a couple of weeks ago that said, here's a cheat sheet on how to manage through crisis. I'm old enough now to have been through a bunch of these, right? 9/11 was the last one, but we've had tremendous economic downturns previously. And you have to stand behind what your principles are. And then in a business sense, I put together our stack. What's most important to us, and how would the energy, attention, dollars flow? And we chose people as being first, and we've lived up to that to date. We said our partners were a part of that, and our players are our partners, so they're in that stack. And then our property, and we waterfall down from there, but we want to walk the talk, and we don't know so much still. That's been the frustrating thing. Markets don't like unknowns, employees don't like the unknown. And so what I've done is say, well, we can't boil the ocean. We need to focus on our little part of the ecosystem, Monumental Sports and Entertainment, and do the best we can for that part of the community, and also to be positive. We want to be additive. I was joking the other day, I see this ticker every day, and it's painful to watch. I said, I missed the ticker when it said, the Caps are winning 5-1 in the third period, and that we want to use sports in as many ways as we can to rally the community, to one day again be a convener. I lived through 9/11. People might forget that Michael Jordan worked with us as a partner. He came back to play that summer. The very first game for the NBA after 9/11 was at Madison Square Garden. The Yankees were in the World Series. Billy Joel held a big concert at Madison Square Garden, and Michael Jordan, the Wizards played the Knicks. The day before, we closed the New York Stock Exchange. They opened that week, and Michael Jordan and I and a bunch of other people closed it. We then went down to ground zero. It was magnificent to see the first responders with Michael Jordan. That was a very touching moment, and sports and entertainment played a catalytic role in bringing our community back. And so we'll play that role again. We might not be the convener right out of the gate, but certainly on television as a content company, certainly as a providing entertainment at home, that's something that we need to do. And the leagues are very committed to our fans and to our community.
So when you do have people coming back into your arena, do you envision that there will be social distancing, or they'll have to be wearing masks, or what do you envision will be the way that they'll be able to come back in?
Well, as I said, we are trying to innovate, and we've got hundreds of people that are thinking through all of the new ways, better ways that we can accomplish our goal. I'm hopeful, and I don't give short shrift to the innovative spirit of our country. I'm an investor in some tech-based medical and healthcare companies. Tempus is a great investment of ours, and I have seen the best and the brightest now in the health services, and I'm hoping that it's more about a vaccine so that we can not have to profile. I mean, that's one thing that in the principles part, I don't believe in. I really would like to find a way that it's a communal resource and that we can have everyone participate. You know, maybe it's through augmented reality, virtual reality, and then eventually when we open the building, certainly we're going to have new tech ways to cleanse the building, keep the building clean. But I'm not buying in any way that we won't be able to eat in restaurants before a game and come to Capital One Arena and be able to enjoy being together. I think it's just, what time frame does that happen in?
So what about your athletes? You mentioned them earlier that they're working out a bit. How do you make sure that they stay in shape? And is it hard for them living by themselves, in effect, or with their families, to get the kind of training and coaching they need to stay in shape?
Well, I've been really proud of the players and the league and all of our staff. Zoom is a wonderful tool. We also are feeding the players. We also monitor the players. We use technology to be able to track what they're doing. I saw John Wall yesterday on television in an interview, and he looked fantastic. He has a gym in his home. He has a half-court basketball court in his home. We're able to watch what he's doing. His weight is way down. Everyone is using this time period, or I hope everyone is using this time period to get ready for the comeback. That's the key thing, to get into new routines. And I think a lot of players around the league will use this time for competitive advantage. That if they can find ways to train, to work on something that was a shortcoming, this 10,000 hour notion of being able to master something. And we've been encouraging every part of the organization, don't wallow and watch television and say, woe is me. Play offense and use this time to do something that matters. Don't let a crisis be this terrible thing to waste. What can we do to innovate, pay homage to our heroes via our philanthropy, make sure our players don't get sick? You know, as I said, everyone in our ecosystem is healthy. That's really important when we know how and when we're coming back. That's been our first focus, the physical health, and then the mental health, and then the economic health of everyone within Monumental Sports and Entertainment.
How are you staying in good shape and staying healthy? Are you social distancing? You have your family with you? How's that working?
My wife and I'm pleased to say, we've been 6 weeks. I've taken it very seriously. If you're a leader, you have to be able to walk the talk. And I wanted to make sure that I didn't get sick. I'm in the demographic. I'm in my 60s. I'm a little overweight. I have asthma. I want to be able to lead our organization and be a good example, and I've been doing that. I've never worked harder. I've never had as many meetings and conversations. I do think that our work will change. I have found this to be incredibly productive. There's no longer staff meetings or important meetings where it's, well, these 3 people can't be here. They're on the road, they're traveling. The last 2 days, I had a bunch of board meetings that are always scheduled quarterly in Chicago. It was truly amazing. I could work out in the morning. I didn't have to travel early. You didn't have to pack. You didn't have to go to the airport and fight through the traffic. And I have found the reclaiming of those travel hours to be very, very powerful. And I'm trying to be very mindful of what I can do with those extra hours.
Now, tell us about what philanthropy Monumental is doing now in the community in which you operate.
Well, we have a monthly program where the organization has been very, very focused on a series of charities. You'll hear from one later with Martha's Table. We also have been working with some of our vendors and chefs to feed the first responders. We and I want to do a lot more with MedStar, Inova, Howard University Hospital. I mean, the list goes on and on. They're really the organizations that the government needs to focus on for a bailout, right? That their business has essentially been about elective surgeries, of which there are none. And so they will have deep, deep economic issues, and they haven't whined at all. All they have done has been in service to the community, and we want to find ways to help them. While I think our level of philanthropy monetarily will increase, it's been frustrating that a lot of what we do, going and working in a kitchen or volunteering with young people in schools, you can't do during a lockdown, right? So we want to help by giving more money, but we also want to help by helping these charities to find different ways to work. I'm personally very involved in educational charities. David, you are too, with your work with scholarship, also the Economic Club. I'm very, very concerned. DC CAP is very, very focused on kids who are seniors in high school, and they're not able to finish school, and they're going to college. And how will that happen? The freshmen or sophomores who have come back now and aren't able to finish out their year, being able to study at home, some of them in perhaps environments that aren't conducive to being studious. And so there's going to be ripple effects and needs through our community. And, we're going to have to step up, all of us. And we have to do it in a time when all of our net worth and all of our financial standing has taken a great hit. I've decided for our organization, our family, we're going to do as much as we can. I think that this is a real reckoning for our society, but it's not the end. Right. And I think the more that we give now, the better we'll feel about our organizations and ourselves on the go forward. And we are going to suffer pain, but shared pain is what the world is built on. My cousin the other day sent me an obituary of one of my uncles. He died at 98 years old. He was a POW in Germany during World War II, and 75 million people died. We all know what happened to communities, the Jewish community. That was the greatest generation, right? we're sacrificing, and I hear like the woe is me. It's I can't go to the bar and have my artisanal beer this week. I'm going stir crazy. And we have to redefine what self-sacrifice is. We have to redefine kind of what our values are. I'm hoping that sports can end up being about heroes, but in perspective to what real heroism is, that who are the people in the community that need our help and support. I'm trying to rally our players. The league is doing so much to rally the players and all of the owners to leave more than we take. And now's the time to do it. We have to forward invest in a lot of these activities.
So a final question, Ted. What main message would you like to give to your fans, your Mystics fans, your Wizards fans, your Caps fans? The main message you'd like to give them in 30 seconds or so?
Well, we love them very, very much. It sounds trite sometimes to say we're in it together, that we will all try to do the right things in the right way, and we'll get through it together. And if we try not to come back to normal, but we build together to better, I think that we'll see this big hockey stick in both value, and we'll feel better about ourselves as a society. And let's play offense. Let's take advantage of this time together and make a better world.
Thank you very much, Ted. I look forward to coming to one of your games as soon as possible.
Thank you. David, are you wearing sweatpants underneath the suit bottoms?
No, this is my only outfit. I only have suits. That's all I have. But thank you very much, Ted, and we'll be in touch. Thank you.
Thank you.
So I'd like to introduce now, we'll do it by audio. For a variety of reasons, we're going to do this by audio. The governor of the state of Maryland. He is the 62nd governor of the state of Maryland. Elected in 2014 in his first bid for election for electoral office, re-elected overwhelmingly in 2018. I would point out that he's the first Republican governor, only the second Republican governor to be re-elected in the 242-year history of the state of Maryland, my native state. And I would also point out that he has been elected by his peers as the head of the National Governors Association. So Governor Hogan, can you hear me?
Yeah, well, thank you very much, David. That's quite an introduction there, and I appreciate that. I also appreciate Ted calling me the biggest landlord in sports in the region. I had never heard that one before, but that was a nice intro also. But thank you for having me.
Well, thank you for coming. And Governor, you've obviously been in the forefront of this. So at the outset, let me just ask you, do you think that the wave that we've seen in New York of enormous amounts of people getting the virus and a lot of deaths, that wave is heading towards Maryland and the District of Columbia area? And when do you think, if you do think it's coming down here, when do you expect it to peak?
Well, hopefully some of the early and aggressive actions that we took here will prevent us from having the severity of the problem that you're experiencing in New York. But yes, the numbers, we are kind of the next wave and the next hot spot. Our numbers are rising fairly dramatically. We've in the region here in the Baltimore-Washington corridor, we've doubled our numbers in the past week to 20,000 cases, and unfortunately the death rate is climbing. So while some places are starting to level off, we're definitely we slowed the growth and we've blunted that curve, but we are unfortunately on the way up that slide, and we believe that it's different models show different things. We have some hopeful signs, but the numbers are rising. We believe that we're getting close to the peak in the next week or so, but that time will tell how effective our all the actions we have taken will be.
Now, the Maryland has a lot of wonderful hospitals and medical schools and so forth, but can you say that the hospitals have enough ventilators, gowns, masks to adequately handle the load you expect?
Well, so thank you for saying that, David. We have some of the best healthcare, I would say, in the world, and we're very proud of the hospital systems that we have in our state. But frankly, nobody was really prepared for the magnitude of this, and so the whole country was caught off guard. The nation and none of the states and none of the hospital systems had the necessary ventilators, masks, and all the PPE that they needed. We didn't have enough ICU beds, and the models that showed without intervention and without action that we would have these peaks that would overload the hospital system. That's sort of why we took all of these unprecedented and drastic actions to stop that from happening. But on the other end, we also have been just moving heaven and earth to try to. We was pushing as hard as we can to acquire more of all of those things, both from the federal government, from the markets, both domestically and across the world. And the good news is we've made a great strides in all of those things. We've dramatically increased the number of ventilators, the number of masks, the rest of the protective equipment. And we're, our surge capacity, we're adding 6,000 hospital beds and ramping up our ability to handle this. But so I guess I'm cautiously optimistic. We were not prepared. I believe we're in much better shape, and we're ramping it up every day, and we're getting close to the point where we hope that we will have enough to be able to handle the surge that we get.
Now, as the chair of the National Governors Association, I think you've asked the federal government to consider a $500 billion additional grant to the states. Is that correct?
Yes, we had a call with the president yesterday and all the governors, and I led that call on behalf of the governors. We again made that pitch. Look, the stimulus packages that have been through Congress have been helpful. I think they are going to help folks that are in need, and that we're getting checks out to people, hardworking folks that desperately need them with our unemployment. They're helping small businesses that are really impacted. But the states have an important role to play. Not a penny of any of the revenue so far helps states backfill their revenues, and there are tremendous shortfalls in the states. We're on the front lines. We've had to take all these aggressive actions. Our small state of Maryland, for example, in July 1, for the quarter ending July 1, we project we potentially may have a shortfall of up to $2.8 billion in revenue. And we need the demand on services that are critically important is greater than ever. And so we're asking for the federal government's assistance. The president has indicated, and Secretary Mnuchin has indicated, that they'd like to provide more help. That's tied up in the Congress right now in the Senate. They broke yesterday, and I don't believe they're planning on coming back until Monday. But the Governors Association is pushing hard to try to get something in this, what they're calling the 3.5 stimulus package that's before the Senate right now.
So for those of us who are not on those calls with the president and the governors, can you tell us what it's like? Is there a lot of back and forth? The governors say what they want, the president says what he wants, and there's a lot of agreement or backslapping or criticizing?
Well, let me say first, let me compliment. First of all, I want to thank the president and the vice president and the coronavirus team. One thing that they've done an excellent job at is communicating with the governors who are on the front lines. And so as chairing the governors, we've had 15 conference calls with all of the nation's governors, including the territory. So in some cases, we have up to 55 governors on our calls. 10 of them, we have had the president and or vice president on the call with us, with some of the top leaders in the federal government. I mean, I think that's unprecedented amount of attention and cooperation. Some of these calls last an hour and a half or 2 hours, and there's real dialogue. So usually the president will lay out the messages that he wants to convey. The vice president will get into, as the chair of the task force, will get into much more detail, and then they'll go around, perhaps Dr. Birx or Dr. Fauci or the head of FEMA or HHS or somebody will make some presentation. But then they open it up for, usually I speak on behalf of the governors and talk about our top needs and issues, and then we open it up to a roundtable, and any governor is able to bring up concerns or questions or comments or suggestions, and it's been very, very productive. I mean, it's I think while there hasn't been complete satisfaction among all the governors about everything getting to them in time, or there's been little, you've read about friction here and there. The effort to try to communicate has been really good, and I think they've been very productive discussions.
So many governors are going to have to deal with the issue of when to open up the state. The president made it clear that the governors are really the deciders in this, the decision makers. So when do you think Maryland can realistically be opened up again and people can go back about their business?
Well, first of all, I think it was good that there was some friction a couple of days ago when the president sort of made the statement that he was going to decide when everything was going to open up, and he was going to tell the governors what to do, and that put everybody in a big uproar. But by the end of the day, the president had completely reversed himself and said that actually the governors were the ones that were going to make individual decisions in their own states about the time frames and what in their best decisions that they could make, and the time frames in their own states, which some would be at different times for different reasons. And that was a good decision on the president's part. And yesterday, he put out kind of an outline of a general guidance, advice to the states about what they should be considering. And that was a pretty good outline for us that lays out, things that you ought to be looking for, but it still left all the flexibility with the states. We have been in Maryland working on this for many, many weeks. We think some of our thinking is in line with the recommendations from the president's team. Some of it is in much more detail, and it looks at a lot of things that maybe they hadn't considered. But first of all, so the president says, first you have to have 14 days of declining numbers. So, of course, we have increasing numbers right now, so we're not quite ready. But then he goes into a series of how you might begin to open up your economy. None of the governors believe you can just flip a switch and get everything back to normal. But we will be, just like we shut things down in a gradual basis. I declared a state of emergency almost 40 days ago, and we took, I think, 37 executive actions, executive orders to do different things. I think we'll gradually start easing things off and opening things up when we believe it's safe to do so. And we're getting advice from some of the top epidemiologists and public health professionals from places like Johns Hopkins and the University of Maryland and MedStar and all the smartest guys we have in the region, together with leaders in the business community and economists and others who are kind of giving us their best information. And we're going to make decisions. We all want to get the economy opened up and our states back opened as quickly as possible, but we're not going to do it in a way that endangers the lives of thousands of our citizens.
Generally, for the major universities in the state of Maryland, they probably have to decide by June or so whether they're going to reopen for the fall or do it online. Do you have any indication of when you think you'll be able to let the universities know that it's okay to go forward for opening up in the fall?
Well, so the universities are, the Board of Regents of the university system in Maryland has the authority to make those decisions, but we'll be consulting with them based on all the input. And it's too early to tell, but right now they did make the decision, obviously, to close for the rest of the spring semester, not to close their universities, but to the physical buildings, except in certain circumstances. And people are continuing their educations with distance learning, with online. In certain cases, that's difficult with certain disciplines, but for the most part, people can continue their education. They'll continue to do that over the summer. And I think everybody's hopeful that they can get to the point where they'll be opening up in a safe way in the fall.
And now let's talk about your own situation. You are working out of the governor's mansion, which is also your residence. Is that correct?
Well, actually, the governor's mansion is just directly across the street from the State House where the governor's office is. And I'm showing up to work every day. We have a greatly reduced number of people working out of the State House, and our staff is pared down to just a skeleton crew that's in the office, but everybody else is telecommuting, and we've got about 20,000 state workers who are working from home and telecommuting in one way or another. But I'm showing up to work every day, but being as careful as I can and trying to take the same advice that I'm giving to everyone else.
Well, you have, because you had some illnesses, obviously cancer, you are more vulnerable than the average person of your age, I guess. So are you taking special precautions?
Well, it's you sound like my wife now, David. I get that a lot. I'm not that concerned about for a guy that's had cancer and is over 60, I'm in pretty decent shape. And I feel fine, and I'm doing well, and I am being cautious, and I'm wearing masks when we're around, trying to keep 6-foot distance, and we're limiting our numbers of people that are around. We're handling most things over the telephone, but I'm really mostly concerned about the 6 million people in my state, and like everyone else, worried about my family and the people I love, and all the other folks that I represent. And I'm not as concerned about my own personal safety.
Well, your family, are they all self-isolating in various places?
Yeah, it's been interesting. So I've got 3 daughters and 4 grandkids, and I haven't gotten a chance to see them. They're all being careful, and they're all being creative. I got very young grandkids, but I'm seeing them on Zoom, and we're Skyping, and it's been kind of fun to be able to keep up with them. But not being together has been difficult.
So when I have to go to, let's say, the pharmacy or to go to the food market, I'm always worried that a Maryland state trooper will arrest me because they say, "What are you doing?" So how do they know that you're actually going to a food market as opposed to doing something else? So what are the state troopers doing? Are they stopping people who are driving?
No. Look, it's not a lockdown situation. We've got orders in place just to try to keep people safe. And obviously you can go out and you can leave your house, and we just are limiting gatherings. And if people go to the stores, we do have an order. We're trying to make sure that people are when you do go to the store, that you're protecting others and keeping people safe. And we're limiting, people are doing social distancing. The retail operations as grocery stores and pharmacies have been really good about cooperating and keeping people 6 feet apart in lines, and they're wearing masks and gloves and really taking every precaution they can. But we understand that people have things that they need to do in their lives. We're not trying to take away anybody's liberties or freedoms or lock them in their house, but we really do want, this is a critical time for us to keep people safe. And so we're just trying to encourage people. As state police, if there's a large gathering or a crowd or some business that's operating in an unsafe manner, and they get a complaint from the health department, local and state authorities will try to go stop that from happening, have a discussion with the proprietor, but they're not out arresting people for
Okay. So if
walking around. So you should be safe, David. I'll put a good word in for you.
If I get a parking ticket, can I just tell him I talked to the governor? He said it was okay to drive.
No, actually, you can drive, but you're still going to get the parking ticket. I'm not going to be able to help you with that.
So the biggest single challenge that you have faced over the last 60 days or so, what would you say it is? Dealing with the federal government, dealing with the state government, what would you say the biggest challenge has been?
Well, that's a hard question, because there've been so many incredible challenges. This is the kind of thing that I don't think anybody could ever imagine going through. When I first became governor, 90 days after I took the oath of office, I was battling riots in Baltimore, and then a couple months later, I was dealing with life-threatening cancer, and I faced a lot of things, but tough storms and whatnot. But this challenge has been incredible, and I think that the biggest challenge has been that it doesn't stop. Every day it continues, and the intensity increases every day. It's sort of like a hurricane that hits every day over and over, and instead of passing by, the intensity of it increases. And so I guess the challenge has just been the nonstop nature of hundreds and hundreds of decisions, and worrying about all these people, that if we don't take these actions and if we don't work as hard as we can, people are going to die. That's really the challenge of it all. And we're working 7 days a week and as many hours as we can put in a day.
So if someone is a citizen of Maryland, or they want to help the state of Maryland, what would you ask citizens to do? Make donations to what kind of areas, or what can they do to most help the situation?
Yeah, well, thank you for asking that, David. First of all, I've been so impressed. Out of tough times and adversity, you kind of sometimes see the best and the worst in people, and we've had incredible people across our state that have stepped up. We have a website called Maryland Unites, where we've tried to put together all of the needs where people say, how can I help? And you can go on there and find places to either contribute or to volunteer, and how you can help your neighbors. And there are things like contributing to the Maryland Food Bank, donating blood to the Red Cross, and just any number of different small community organizations that are doing wonderful things to help our frontline healthcare workers and our doctors and nurses and first responders, and just helping a elderly neighbor that could use a hand, somebody check in on them and see if they can't pick up some groceries. Or there are plenty of things that people can do, and we really encourage that. It's been amazing to see the people willing to help their neighbors who are in need.
So as you get ready to deal with the crisis that's coming, the wave, you feel that there's any particular need to do any more social distancing or any more things than you've already put in place over the next week or two, when I expect you think there will be the greatest wave of virus hitting us?
No, I think we've taken about every kind of action that you can possibly imagine. We've been taking action earlier and more aggressively than almost anyone in the country. And my hope is that as we start to see a leveling off and our numbers decreasing, our plan is to kind of lay out a roadmap to recovery and to start easing off and lay out a smart, safe way to reopen. And instead of adding more things, I think we're going to start to taking things away as we start to see our numbers level off.
So two final questions I have for you, Governor, is what would you say the lesson that you have learned from this experience? What have you taken away? What did you learn that you didn't know before as a result of going through this experience as both the governor of Maryland and as a chair of the National Governors Association?
Well, so I guess the thing I just mentioned a moment ago, I guess I knew it already, but just seeing all the good people. I mean, I never imagined how many people would be suffering and struggling economically, and nobody can imagine how bad it would be. But also to see the people stepping up and helping has been incredible. But I guess the other thing that's been kind of pleasantly surprising as governor of Maryland, and also as the chair of the NGA, has been the bipartisan cooperation among the Democrats and Republicans coming together. I can tell you that I'm on the phone every day with Democratic governors and Republican governors on an individual basis, in groups of governors, and then with the whole team. And there really are nobody's wearing blue jerseys or red jerseys. We're all in this together. The folks in Congress that push things through in a unanimous bipartisan way to help the American people in a very short, period of time. I think it's out of adversity comes opportunity. I think we maybe have an opportunity to maybe fix the broken politics in America, and it's surprising and hopeful that maybe when we start to get this virus under control and get our economy back, maybe we can find a little better way for us all to work together and to get things done regardless of party affiliation.
I didn't mention at the beginning, but I think the two governors in the United States who have the highest rating in their states are the governor of Maryland, the governor of Massachusetts. So you have a very high rating in the state of Maryland. But are you upset that you can only serve 2 terms as governor of Maryland, or will you be happy that will actually, your term will end at some point and you can go on to something else?
Well, frankly, to tell you the truth, Dave, I kind of wish I'd run for governor in Virginia, because they only have 1 term limit, and I'd be relaxed, and I wouldn't be going through all this stuff right now. But no, I'm just kidding. It's been a tremendous honor to serve as governor. I've still got a few years left to go here until January of 23, but it's an awesome responsibility, and this is a tough time to be serving, but it's an honor to be here, and I'm happy to have this job to serve my fellow citizens. And I don't really care much about popularity, but I'm glad that people think that we're doing a good job, because we have a great team of people that's doing their very best to try to keep them safe.
All right. Well, Governor, thank you very much for your time and the job you're doing. And obviously, we hope a lot of people who are watching and listening today will contribute in the ways you've suggested. So thank you very much for being with us today.
Thank you very much for having me, David.
Bye. Okay, so we've now had Ted Leonsis, and we've had the governor of Maryland, and now we're going to have Kim Ford. Kim Ford is the president and CEO of Martha's Table, as I mentioned earlier. She has been doing that for about a year or so, and replaced and succeeded Patty Stonecipher in that position. And she's had a wealth of experience in the federal government, worked in the Obama administration, and also at the University District of Columbia. And Kim, for those people that are not familiar with Martha's Table, in 30 seconds, tell us, or a minute, tell us exactly what it does.
Absolutely. So first, thank you, David, for all of your support for Martha's Table, the Economic Club, Ted Leonsis, and Monumental Sports for all of their support. And I do see two former presidents on the line, so shout out to Lindsey Buss and Patty Stonecipher. Welcome to Martha's Table. What we do, this is our 40th year. We are 40 years strong. We're very proud to support strong children, strong families, and strong communities. We do that through nationally accredited early childhood education programs, through health and wellness programs, promoting healthy markets and healthy living, through family engagement and community supports, like our Outfitters Boutique, where people can shop at no cost for children's clothes and adult workforce attire, and our longest standing program, McKenna's Wagon, that goes out every day and provides a hot meal to those who are facing housing instability.
Okay, so who was Martha, and where's the name Martha's Table come from?
Well, Martha does come from the Bible, and she was Mary's sister. She liked kind of being in the background. She was the one that was in the kitchen. Wasn't the forward-facing or front-facing person, but wanted to make sure that she could support folks, in that background kind of way. And that's very much like Martha's Table, is that we stand alongside the community, but we do it from a different vantage point, if you will.
Now, your main building is in Anacostia, is that correct?
Yes, we have moved our headquarters to 2375 Elvins Road Southeast. It's a beautiful building. We welcome anybody who hasn't been to come join us at the table. 57,000 square feet of the most beautiful space you've ever seen.
Now, you have programs where young children come there during the day, preschool, and they do various things, learn and so forth. What is going on with that program right now?
Yeah, so with our COVID response, there are really two big areas that we're hoping to talk about today. One is our food response, and then also our education response. So we do have two nationally accredited early childhood education centers. One is at our headquarters in Southeast, one is in Northwest. We support over 200 young people, 6 weeks to age 4. And so we did have to close our schools. In closing our schools, we have provided a comprehensive support package for those families, including cash transfers of $750 a week, including $15 worth of credits to a grocery store via a gift card, also diapers, wipes, and formula for those families, because we knew that our families would be some of the hardest hit during this crisis. I saw a parent, after the national conversation about cash transfers started, parent out front said, "Hey man, Martha's Table started that. You should tell them." But as we remain closed with our education programs, we are supporting our families also through distance learning. We talk to our families every single day. We have an online technology where we send lesson plans. Our teachers continue to be very engaged. We send lesson plans. We send materials to our families, including things like sensory kits. So when you're talking about particularly young children, there's a lot of play that you have to do. There's a lot of sensory that you have to do with those young children. So the learning continues in this environment, but again, also just supporting those families who are again being hit very, very hard by COVID. We just completed a survey where over 80% of our families participated, and there's two really big themes that have come out. I want to make sure I get the quotes right. One was the cash transfers definitely came in handy when my hours were cut back at work and I'm not receiving as much as I'm used to. It's really a lifesaver, and I'm very grateful to be able to receive a stipend to help my family during this pandemic. That's a big theme that we're seeing. People are losing their jobs, their hours are getting cut back. And another theme is families are not only suffering financially, but mentally, because the health scare is causing many folks to live in fear and anxiety. And that's another big trend, is that there's a lot of stress. There was already stress in the community. This has certainly exacerbated that stress, and stress then can manifest itself in a number of ways. And so we're just glad that Martha's Table can continue to stand by those families.
Now, I saw on television last night, like in Dallas, there are something like 10,000 cars lined up on food banks to get food because people have been laid off and now they're getting food. I haven't seen that in Washington yet. Is food readily available to people needed through the various food banks and programs like Martha's Table? And can people contribute food to you, and how do they best do that?
So I'm so glad you asked. That's the second pillar of our response. So we want everyone to know Martha's Table is open. We are open, and we are actually expanding all of the work that we do in food. So our lobby markets are open from 11 a.m. to 4 p.m. in Southeast and in Northwest, and in Southeast also on Saturday from 10 to 2. We have added 10 community grocery drop-offs in Southeast throughout the community, where we're supporting an additional several hundred people a day. We are going out to buildings where seniors are not able to come out and dropping off hundreds of bags of groceries a day. We are supporting the DC government meal sites through wards 7 and 8, where again, hundreds and hundreds of bags. I'm actually looking out right now and seeing our vans are being loaded up with over 600 bags of groceries that will be going out to support those efforts. And we've expanded our hot meals program. So I mentioned McKenna's Wagon earlier. In addition to that, we've launched a great partnership with Food It Forward DC, with the Clyde's Restaurant Group and Need Hospitality, where 400 hot meals are going out, again, to those in the community, those who are facing housing instability, seniors who aren't able to come out. And so when you talk about the lines and lines of cars, we do see that quite often. Our demand has grown fourfold. We used to have about 600 bags of groceries a day through our joyful markets and through our lobby markets. Now it's over 2,000 bags of groceries a day, and it continues to jump.
So let's suppose somebody says, I don't have a lot of extra food in my house, but I have some money. Can they give you money?
They certainly can. We absolutely would welcome
Where do they send it, or how do they send you money?
All right. Well, www.marthastable.org/donate. Folks can actually contribute, and you can contribute at any level. We have seen amazing grassroots support, and we really want to appreciate everybody who has stood alongside us during this tough time. Folks can, a bag of groceries is about $10, so you can use that as a multiplier effect. Again, we're going through 2,000 bags of groceries a day. We would welcome particularly the Economic Club and business leaders to think about, the $10,000 level. That's 1,000 families with a bag of groceries. And it's important to note that these are healthy groceries. It's shelf-stable items and healthy fruits and vegetables. So it's not just food, it's good, healthy food.
So when you took this job, you knew it would be not the easiest job probably you've ever had. But what's been the biggest challenge in light of the virus? And I noticed that you're in the office, as we discussed earlier. How come you're not at home?
Well, kind of like the governor said, we're trying to model behavior, but, you still have to be boots on the ground. There's so much about our operations where you actually do have to come in. We are combining food access with safety. We are also on a very skeleton model of folks coming in. Most folks are on telework. Our volunteers, we see ebbs and flows in volunteers. That's another way that folks can get involved, volunteering by contributing. But there's still just a lot that we have to do, and and who wouldn't want to come in and see this beautiful artwork behind me?
So no regrets about taking this job, is that correct?
None whatsoever. I'm proud to be at Martha's Table. I'm excited every single day to get up to support this community. Nobody could have contemplated a global pandemic, but I'm so glad that an organization like this, that we can continue to walk alongside our community in really tough times. That's what it's about. That's what we're supposed to do, and I'm just so proud to be on this team. Martha's Table team is the greatest, 40 years strong, and since we had Ted Leonsis earlier, Martha's Table for the win.
Okay, final question for you. What is the main message you'd like to give to Washington residents, Washington area residents, the main message about Martha's Table and what they can do right now, this simple message that you want to give to people?
Martha's Table is open. Everything has significantly increased in terms of demand. So please support us by contributing to us, by donating to us, both financially and maybe your time through volunteer opportunities. But we are open. We are going to continue to stand alongside this community as long as possible, no matter how long it goes on.
Kim, thank you very much for what you're doing at Martha's Table, and thank you for coming on today. And I hope everybody will respond and do some things that can be helpful to you. Thank you very much, Kim. Thank you.
Thanks so much.
To remind everybody, I want to conclude my remarks today by saying that I hope you've enjoyed and thought these programs have been useful. We're trying to get people in the community to tell what they're doing in many cases and give you useful information. We probably will have another program to be announced next week, Friday or so. We're working on that now, but we do have the program I already mentioned with Tony Fauci the following week. If anybody has any suggestions about things we can do that we aren't doing on these programs, please let us know. And let me conclude here and say thank you very much for your participation in these programs, and thank you very much for responding to the efforts that many people have made here to seek community support and business community support. Thank you very much.